what happens is on the right hand side of my screen, I can see your comments scrolling up there. The last time I did this, the comments, like people were asking questions just too quickly, and I was starting to lose them, and I was having to rush through a little bit. So, so if anyone's got a question, if you post it there in the comments, I'll try and answer it. And as I'm getting towards the end of it, and so if you want to post another one, that's absolutely fine. I'll try and answer them all. We've got about an hour or so. So yeah, fire away. Ask me anything you want about being a vet, or what we do, or your animals, or anything like that. Try and, if you've got a specific problem with your dog that's already under treatment from another vet, professional body, the Royal College say that I can't comment on that case, unfortunately. But if you want to talk in generality, then I'm more than happy to try and answer any questions you've got out there. So who's first? Sonny to come back in, refusing to go back out. What, no questions?
I think they've already asked them all.
Angela's saying out here that you've already asked the Banbury vet. Have you found it a useful site? I've really enjoyed it, by the way. Answering all these questions. Oh, blimey, 3 at once. Lisa, do we offer work experience? Yes, we do. But we're, as expected, we are really heavily subscribed for it in advance. Your best bet is to email Lorna at mansionhillvets.co.uk, and she'll see if she can find a slot. You have to be 16, unfortunately, because we do work with a lot of dangerous radiation. So yeah, 16 and over. Will you come along and see what we get up to? Yeah, not a problem. Oh, right. There we go. Let's have a little look up here. Hell Beacon, food. What do vets really recommend? I would say good quality. Good quality food. I personally feed our dogs on Arden Grange because it seems to do them really well. I think ultimately it's about seeing how your dog is. Some dog, just like some people are, perhaps gluten intolerant or intolerant to some other ingredients in the food. So dogs can be as well. So it's seeing what works for you. I know there is a lot of passionate argument about whether we should feed raw and that sort of thing, and I did go on ask the vet. But personally, I feed Arden Grange and find it perfectly good. But I wouldn't promote it. No. I just had a small. Dear. That's my youngest son. Thank you very much, Ange. He's just come downstairs. But yes, and of course, if they've got a medical issue, then you need to feed the food appropriate for that medical issue. What is the best way to keep a dog cool in this warm weather? That's from Natalie. So essentially, air movement to try and ruffle the warm air out of the coat is very good. Keeping them damp, plenty of access to water. And I wrote an article on about whether you should clip them or not. Certainly dogs with very thick woolly coats benefit from clipping to a certain length. Dogs that have a shorter, shinier coat don't benefit from clipping to a certain length. Keep them out of the sun. Walk them in the early morning and late evening when it's nice and cool, and you should be okay. Right, Josephine. Hi, I'm using Advocate. I have done for the past 2 months, but my dog has still got fleas. It's a bit of an old chestnut, this one. So Advocate imidacloprid has no resistance. There's no resistance to it in the wild that we've seen so far. So if your dog's still got fleas, there are two things that could be. Well, there are a number of things that could be a problem. There could be a problem with how the Advocate's being applied. If too much of it is going on to the hair, it needs to go onto the skin really. You could be washing them, or the dog could be getting wet, and that will reduce its efficacy. But by far and away, the most common problem is that 95% of the fleas actually live in the environment. So as eggs and larvae and things like that, what happens is they kind of scurry around in the carpet, eating dead skin cells and that sort of stuff. And as they mature to their later forms, they hop onto the dog, and that's when you see them. So when it's warm like this, and to be honest, with centrally heated houses, it's a problem all year round. Their life cycle can continue. They do need a blood meal off the dogs. So what we often find is that there's other animals in the house where the flea is completing its life cycle on that other animal, and then they're jumping back onto the dog where they die. But they do need to bite to get the imidacloprid into them. So if you've got cats or other animals, you need to treat all the animals in the house. 95% of dog fleas are in fact cat fleas, and you might want to think about spraying the house as well. And there are various things out there. Indirect spray, scoosh, these sort of. Sure that basically what I recommend is hoover all around the house, get it all warm, get the fleas jumping, and then spray it. They do have compounds in them that are toxic to fish, so you need to cover any aquaria or anything like that. But apart from that, yeah, it's pretty safe, the stuff that you're using. It's very safe, the stuff like that. Okay, hope that answers your question, Josephine. Marie, glad you like the site. Elspie, can dogs get hay fever? Yep, they can. They're just, they're like us, really, and cats. We have slight quirks in our metabolism between us, but yeah, they can still get hay fever. Any kind of allergies, really. So an allergen, sort of pollen, that sort of thing coming in, causes inflammation in the nose, in the eyes, and that they can get sort of sneezing, coughing, water. Epiphora, so water coming from the eyes, but they can also exhibit in their skin as well, chewing their feet, getting redness there. So yeah, they certainly can get hay fever. Yeah. Kitty loves a sausage, don't we all? I know we should restrict her, but she won't stop. The last one we had a row because she wanted a third one. I told her weight for weight. That's like me eating 51 sausages. I can't eat 51. How the heck can she eat 3? I've seen dogs eat an amazing variety of things. I remember a Labrador that a cake that was this sort of wide, about that deep. It was actually in the staff room at a previous vet's that I worked at, and the dog was just lying on its back with 4 legs in the air, just looking absolutely run to the gunnels. And probably 3 years ago, we took out. The dog came in, another Labrador. These Labradors, I know Kitty isn't a Labrador. Labradors seem to be a big problem here. Yeah, the dog came in and we emptied out of its stomach, and it filled a builder's bucket full of food. I mean, it was incredible. I think it'd eaten something like a 15-kilo sack of food. So yeah, extensible stomachs, but not recommended. John, what do I think to magnetic coats boxers for post-dog workout? The greyhound. I know what you're kind of getting at here, Courtney. So there's no scientific evidence behind it, but I have to say I've seen people use these sort of things with dogs with arthritis, and they report benefit. Now, whether that's a placebo effect for the owner reporting it back to me, I don't know. When I was in the army, all the King's Troop and the cavalry horses used to get wind galls, which is inflammation around the fetlocks as a result of being exercised on the road when they were in London the whole time. And the colour sergeants there were very insistent on them wearing magnetic boots. And quite frankly, they couldn't give monkeys whether there was any scientific evidence or not. They found that it worked to reduce wind galls. So there you go, and magnetic blankets and things like that. But whether it works or not, I say scientifically there is no evidence base for it, but anecdotally people find that they do work. Leslie, I have a 7-year-old indoor cat. How can I let her in the garden without her running away? She is scared of everything. Uh, it depends what happens when she goes into the garden. Um, so cats outside the house are territorial. That each cat has a territory, like a block, and go not necessarily just your garden. The cat next door might decide that your garden is its territory. If they fight as a result of that territory being compromised by your cat coming into it, there is every chance she might run away, unfortunately, because cats are biologically driven to try and find a territory. So how can you get her into it? Well, cats will share territories. So if you have another cat and it establishes a territory there, your two cats then might go out there and defend. Well, perhaps the other cat will defend it. Your cat may not. Other than that, it's just keeping a close eye out. See what other cats are coming in and a close eye. And let her gently extend the territory, because as she goes around and she wheezes in it and she marks it and things like that, other cats will start to detect it and will shrink away a little bit. So over time, you may well find that you get to reclaim your garden as a territory. Natalie, Arden Grange. Yeah, can do. Individual response. Absolutely. It depends on what your dogs get on. My dogs get on very well with it. So I don't think you can, on the basis of your reaction, write off an entire brand of dog food. My dogs have reacted to other brands of dog food. So yeah, it's just a very individual reaction. Blue-green algae. It's found in ponds. It's dangerous. It contains a toxin. Off the top of my head, I can't remember the exact name of the toxin, but they have to ingest it. So it's dogs that swim in kind of green ponds tend to have problems with it. Mel, what's the best food to feed Toby with his overactive thyroid, and will he ever put on weight? So Toby's a cat, an older cat with an overactive thyroid, hypothyroidism, which is reasonably common in old cats. So with older cats are they need a lot of protein in their diet, and definitely as they get older, they need more and more protein in their diet because they become less good at absorbing it. So I would say a high protein diet is what a good source of protein in there as well. Good quality diet. Will he ever put on weight? Depends how well it's controlled. That's the problem. Some cats are extreme pills, and some cats aren't. Some cats you need to use a cream with. Some cats you need to do surgery on, which is a bit of an old-fashioned way of doing it. Some cats you can use radioactive iodine therapy on to try and reduce the activity of the thyroid gland. So it all depends on how much it's controlled. I mean, certainly you can, with surgery, for instance, remove too much thyroid tissue and push them low, hypothyroid cats, and they will put on weight. So yeah, if he's not putting on weight, it may be that his thyroid level is still a little high. So the old thermostat is running a bit too fast, the metabolism is running too fast, and that's what then causes the weight loss. Of course, it's also in older cats. So like we said, they don't absorb food so well, but commonly you'll find, just like in older people, there's not just one thing wrong. You might find two or three things wrong. So it can often go hand in hand with renal disease as well, which can cause them to lose weight. Not to scare you with that, but just make sure that the blood tests are done and up to date, and all other health issues have been ruled out. Carol, I confess I never worm or flea treat my dogs, and they never had fleas as far as I'm aware of worms. I'm just looking at there are certain breeds. I'm a bad dog for doing this. Well, if they've not had any fleas, then fine. Dogs. Some dogs are more resistant than others, and some dogs, perhaps live in an environment that doesn't have as many fleas in them. Perhaps they're outside a lot more, where there's no cats, that sort of thing. Worms, as far as you're aware, they haven't had worms. Not all worms are detectable. You'll see a tapeworm, you won't necessarily see roundworms. I would suggest that worming, just from a public health point of view, is a good idea to do. Are you a bad dog mum for doing this? No, you're not a bad dog mum. Very simple to give, though, just a tablet. Where are we? Back to the flea question. I have put Advocate on both cats and my dog. I've stripped the beds, sprayed the beds. Do you think it's just the eggs that are hatching? Does Advocate not kill the eggs? Or what can I get to kill the eggs? Nothing. Only physical removal acts to remove the eggs and the cyst stages as well. And because the life cycle in this warm weather is going every 3 weeks, you have to constantly redo it as well. So I'd be looking at redoing your Advocate and stripping beds and hoovering and spraying sort of every 3 to 4 weeks in that case, just to make sure that as the new tranche of eggs and encysted larvae start to hatch in the carpet, you're killing them. So essentially, your first round will kill 90% of the fleas there. So then 10% there, they'll start to hatch out. You need to kill them. So then you've got 1% of the population, and you need to kill them again. You're back down to 0.1% of the population. It's an exponential reduction. You'll never get them all just with one hit. Marie Whittenlock. What is the best flea tablet for cats? Sweep has a reaction to drops. We don't tend to use flea tablets in our place too much. Next guard is drops. Comfortist, does that come as tablets? Comfortist for cats. Everything seems to come as drops for cats. Yeah, seems to come as tablets. There you go, Comfortist. It's very effective as well. If they have a reaction to drops, you might want to consider the Stresto collar. That's quite good as well, Marie. Haley, my boxer has a few lumps on her gums at the back of her mouth. They are not bothering her. Should I get them removed? Thank you. Well, it kind of depends what they are. There are a couple of things. Boxers really, really commonly affected by something called a poolie. Let me see if I can find a picture of a poolie so that I can show you guys. Which are very, very benign things and generally don't cause problems. Some horrible images coming up here. So hopefully everybody can see this. Is it a bit washed out maybe? Oh dear, what have I done? Might not come up too well. Oh yeah. So I don't know whether this is going to show up on here. So you can see just in up the other side, just in here, that kind of that pink growth there is called an apulus. It's just a benign overgrowth of the gingival margins. Generally don't cause any problems at all. If they do cause problems, it's because they're getting traumatized when the dogs are eating and bleeding. It can get infected, but really, really unlikely because such a good blood supply there around the gums. Can be removed if you want, if they're causing a problem, but in general, tend to leave them alone. However, you need to be really, really careful that you differentiate them from squamous cell carcinomas within the mouth, which are really nasty cancers in the mouth. So it's worthwhile getting them checked when you're next in for a vaccination or something like that. And a poolis will essentially generally be the same sort of colour, nice pink colour as the gums, and they won't tend to grow a huge amount, whereas squamous cell carcinomas look really aggressive and really horrible, really nasty. Marie, yes, I do have dates for the Pet First Aid course. We have another. Do you know what? I meant to put it on the group. I'm really sorry. We have it on. Let me see if I can find on our events page on our website. So we have another talk, and that is going to be on Friday, the 12th of October at Middleton Cheney Village Hall, and we have a first aid practical session for professionals, which get a certificate and all that sort of thing. Saturday, the 22nd of September. The Saturday session is morning, 9 till 12. The Friday session, the first aid talk, 7:30 to 9:30. There we go. Let me just pop that in there. Hello, Val. Now Val is the rescuer of Sonny, and we were just saying, oh, Sonny's disappeared off somewhere. He's had enough of having his grooming. Hello, Claire. You'd be glad to hear that Sonny's doing very well, Val. Thank you very much. So have we got any more questions? There'll be 10 people typing comments now, and they'll all come at once again. So, hi Val. Oh, you're in France at the moment. I've just got back from the Dordogne. Very nice. We cycled up from Toulouse to Cahors, and then across from Cahors through Bergerac to Bordeaux, where we watched the World Cup final and the French going absolutely bananas, torching cars and things like that. All great fun. Lola's been to the vet and they said that she's had a slight heart murmur. She's been so upset. Could it have been being scared? Unlikely, I have to say. When they get scared, usually heart rate comes up a little bit, and that shouldn't really affect murmur. A murmur, I've got a murmur. A murmur is essentially an extra noise in the heart. So it's when there's perhaps a slight abnormality in where the blood circulates around the heart. Oh, I better here's Sonny again. That's for Val. There you go. There's Sonny. Look at that nose. So yeah, sorry about that. So you might see a nose appear in front of the camera any minute now. Yes, there it comes. So when the blood is flowing around the heart, and perhaps maybe there's a leak in a valve or something like that, you hear this extra noise in the heart. Think of it as a tap. When you tap's running smoothly, there's not much noise from it. When you turn it off, it starts to develop more noise, and it's from the turbulence there. So really with murmurs, you've got to assess them in combination with a scan of the heart's really, really important, I have to say. Looking at sort of clinical history, are there any breathlessness, that sort of thing, their colour, just a good clinical examination of them, and also the type of murmur as well. So we assess them in terms of their volume, but also in terms of their quality as well. You know, is it a whooshing sound, or is it a sort of ramping sound? So does it go whoosh, whoosh, or is it more of a whoosh, whoosh, whoosh? Is it during the diastolic, the relaxation phase, during the systolic, those sort of things? So there's lots of things that we ought to consider when we're talking about murmurs. Generally, you know, we score them, and we would then re-examine the next year, and we look at the score again, and that would give us a much better idea of what's going on. But, you know, answer to your original question, probably not because she's scared, I have to say. And certain breeds do have congenital problems, so things like breeds like boxers, breeds like cavies can have problems with abnormalities in the heart. Carol, what's the oldest dog I've known? Just curious. Do you know there was he sadly, yeah. No, I think like Angela's suggesting in the background here, there was a dog last year that, oh God, I think he was getting on for like 18, 19. But they tend to be these mixed breeds that people have kind of picked up from rescue centres, and it's all a little bit hazy when it comes to when they were actually born. They say, well, we had them 17 years, and the vet said that he was 3 years old. So, but yeah, high teens. I don't think we've had a 20-year-old yet. Yeah, we've just been talking about keeping dogs cool, actually, Val. Yeah, wet towel. Carol, hi, John. I've just used our Stronghold and Dronsit drops on our cats. How often should they be repeated? Also, we use this as our male cat lost a lot of weight, but seems quite happy with himself. Could weight loss be due to the weather? First of all, yes, it can be due to the weather. and also cats just being out and about a lot more at this time of year. Loads of cats lose weight this time of year, and it's important to assess their condition and make sure they're not losing muscle. If they're losing muscle, then that would be more of a concern, really. Um, Stronghold is once every month for cats. Dronset does the tapeworm for them. Now, the tapeworms are spread by fleas, so if you control the fleas, you should, with Stronghold, you should be controlling the tapeworms. But generally, I recommend every 3 months for cats because they might pick them up from other locations as well, other sources, and you should be absolutely fine. Now, we do a little bit of a risk assessment on this. That's our sort of standard advice. I guess cats which are serious hunters, you might want to do it a little bit more. Cats that don't go outside, you can decrease it a little bit. Oh, hi Jack. Can you join the practice easily? Yeah, well, you can. You're more than welcome to come along and chat and see what we do here. We're a small practice, but very much we try and emphasise giving a best service we possibly can, and offering as many things under our roof as we can. So we do things like cruciate repairs, and I'm in the middle of trying to buy a CT scanner at the moment. We do stem cell therapy, that sort of thing. We don't, because we're a small practice, we don't employ new graduates. So myself, Ewan Richards, and David Moore. I've been qualified for nearly 20 years. David is 16, and I think Ewan's at about 5 or 6 now, perhaps a little more. So we're all pretty experienced. Well, we're very experienced vets now, and we all have our own little interests. I like my orthopedics. David likes his soft tissue surgery and ophthalmic surgery and cardiac scanning. Ewan's into his imaging. So yeah, and we have just the best team of nurses and receptionists as well. They're a really good bunch. Yeah, it's a lovely place to work, I have to say, and we get it's really nice to be part of the village here, and I have to say we get an awful lot of support from people here in the village. It's really nice. I count myself as a very lucky person, because a lot of my compatriots aren't too happy with what they're doing with the increasing corporatization of the veterinary world. So yeah, I really love it. In fact, I do on call every night. So I'm sat here with my phone beside me. It's good fun. Oh, Mel, thank you very much. That's very kind. Thank you, Marie. I think it's all about trust, isn't it? That's the thing with being a vet. You take your loved animals into a building, and you trust that the people in there are going to treat them in the way that you want them to be treated. And that's something we've always been very sensitive to. We are pet lovers ourselves, and I've always wanted to work in a practice where I could hold my head up high and say we do our absolute very best for you and your animals. Angela's now polishing a saddle outside. It looks very shiny. What's the biggest killer in dogs? I'm going to go out on a limb here, and I'm going to say arthritis. Sorry, what was that? What did you say? Did you say sex? Oh. Arthritis. It's really sad, actually. There's so many animals out there, so many dogs out there who just, people say gone off his legs, and their minds are still working, and they just can't get around anymore. And it's due to degenerative joint disease, but it can be because perhaps they've been too heavy during their lives. It's not been addressed early enough. They've not had, it's not been looked at from a curative point of view rather than just managing the pain. And yeah, it's very sad. So I'd say arthritis. What else is up there? Probably, we get a fair few intractable cancers come through, especially when they're painful. So I think I'd say the biggest killer is just not having a life worth living anymore. That's what it is. It's not like in people where something actually kills you. That when animals come into us, we have to put them to sleep. So people have made that decision to put them to sleep, and they've made that decision based on, that the animals, their pet's life is just, it's more painful than it, unfortunately. Oh, thank you, Cameron. Yeah, as Lucy has OCD. So OCD, not obsessive compulsive disorder, is osteochondrosis dissecans. So that is a developmental problem within the joints. Does she have an increased chance of arthritis? Yes, she does. Unfortunately, because her joints haven't formed properly, and because the cartilage layer on her joints hasn't formed properly and it's kind of flaking away, that will lead her to increased risk of arthritis. Um, so now, we can do things like anti-inflammatory injections into the joints, and we can do arthroscopy where we go in and remove those flaky bits. But with stem cell therapy, we can look to increase the healing of these joints. I'm not saying you're ever going to make it into a perfect joint again, but yeah, you could certainly, we can push it back towards a more normal looking joint. And we're finding now sort of 90% of dogs are getting significant improvements in their pain scores with stem cell therapy. So yeah. Oh, Amy. What can you do? So there's those medical treatments we were just talking about there. I think supplements are good. It's I think the only supplement that's ever really been tested, because these manufacturers are a bit cagey about getting stuff tested, is Human from the Royal College down in London did some studies on it and found it to be good, and that has omega-3, glucosamine and chondroitin in it, and they essentially said it was the omega-3 that's causing it, the omega-3 fatty acids. So they've been shown to clinically improve these things. Keeping on top of, like I said, weight, exercising her properly, making sure that so she's not, no ball chuckers, that sort of thing, making sure that the environment is good for her so she's not slipping, falling over, make the supplements. Yeah, I think those are all. Physiotherapy can really help with these things. So swimming, walking underwater, lasers, um, other surgical interventions. Well, like I say, we can remove the flaky bits from in there, and we can burr back any inflamed bits. We can ultimately can look at joint replacement if needs be. With regards to sort of other things that can be done, managing pain with painkillers, yeah, you can do, and there's lots of different types of painkillers. And then there's adjunctive therapies, we call them, things like cartrophen, which is supposed to increase the blood supply to the subchondral bone, so that's the bone underneath the cartilage, which helps again with the healing. Because you've got to remember, with arthritis, you kind of got some damaging it, and you've got a healing thing on the other side. And what you find when they're young, the healing is over. It's keeping on top of the damage, but as they get older, they can't heal quite as well, and the damage gets more and more and more until it becomes an overwhelming thing. What you want to do is just reduce the amount of damage being caused, but improve the healing as well. So that's the balance you want to get. Do little dogs like mine get arthritis? Small black dogs live forever, as far as I can tell. They do extremely well. They're essentially over-designed. So a big dog, classical Irish Wolfhound, lives till 7. Little tiny Yorkies will quite happily go to 16, 17, 18 sometimes. So yeah, they've just got a lot. Their legs are designed, and so they just have less pressure going through the joints, and they last longer. They do get arthritis though, but much less frequently and to a lesser degree as well, I would say. Hi, John. Brian, the three-legged rescue kitty, is around 3 or 4 years old. Going forward, how will this affect him? Is there anything we can do to help? It shouldn't affect him at all. All animals, especially cats, have got 3 legs and a spare. Shouldn't affect him at all. Is there anything you can do to help? Not at all. That should be absolutely fine. Maybe arthritis, maybe slightly more at risk of injuring the leg, the solo peg leg. Maybe slightly more at risk of developing arthritis because more load in it. But no, you'd hardly know with some cats that have got 3 legs. Okay, Mel, you can come and have a look. Mel, I'm going to tag you on a couple of articles that I've done here. So I did an article in conjunction Oliver Byrne on case management. So let me just tag that on there in here for you. So that's something I wrote with Hannah, and that's a 2-part article. And then I'm going to tag you in the stem cell. There's loads of evidence papers, loads of papers for evidence at the bottom of this article. So I really recommend having a good read through there. Phew, I don't know about anybody else. I'm boiling this evening. Yeah, no, it shouldn't affect us all, Amy. Should be absolutely fine there. Right, I think we've got another 20 minutes. Are there any more questions? Don't feel like you have to be restricted to animals as well. You can ask me what it's like to be a vet. It is warm, isn't it? Probably not as warm as Val in France. I think it was 33 when I was cycling in the shade, and then 40 degrees in the sun. It was unbelievable. Really nice though. And swimming in the Dordogne, it was like a big, long, wide swimming pool. Okay, what do I enjoy most about being a vet? Um, well, clearly I love animals, so that's a given. I find that it is enough of a challenge for me. Yeah, I find it incredibly interesting. I find it's not so samey, So every day is very different, in fact. Um, and so it's not so samey that I get bored, but at the same time, I'm at a stage in my career that I feel competent, and yeah, so and I enjoy doing new things and improving myself. As Angela will tell, in fact, she said to me the other day, I'm a very difficult person to live with, because I do enjoy just pushing and doing new things. And my career, gives me that option to do it, and in a what I think is a really socially useful thing to do, a place to be and to do, and you know, being part of the community here in Middleton and the surrounding villages is absolutely wonderful as well. We get, I can't move in the place without saying hello to someone. It's really really nice. My family. Well, my father's from Stockport up near Manchester, but my mother's side are all from Galway, and it always reminds me of when we were kids, and I used to be going around with the vets out in Ireland, and you'd know everybody on the road as you go going around, and I find it's really really nice thing to have. Jackie, what made you do this Facebook page? I don't know really. I just thought it would be a good idea. Um, I We had a clients group which few people asked questions on. I think there was just a feeling that there's a lot of people out there with questions, and that they feel like, well, we shouldn't bother John with the questions. You won't be interested. And I thought, well, a lot of people do use Facebook, and why not give it a crack and see what happens. And I think I saw another one called it was Ask a Nottingham Vet, and I thought, well, ask a Banbury Vet, go for it. And yeah, it's been great, really fun. My eldest is 15 next month and still going strong. He sometimes get what he thinks is dementia. Can dogs get dementia? Yes. Yeah, they can get dementia. Unfortunately, they suffer from the same kind of spectrum of neurological disorders as we do, because their brains are very similar to us. Um, Dementia, I think, is a very loaded word, isn't it? It's a very much human thing. But certainly they can get confused and exhibit all the same sort of signs. Hey, Jason. Mel, how do you cope when you have to put an animal to sleep? Ooh. Um, uh, um, I have to be honest. It's tricky sometimes. It's tricky all the time. Actually, it's quite upsetting, and I find it. I've always sworn that the day that it doesn't upset me is the day that I should hand my stethoscope in. Really, someone's got to do it, and it may as well be me. That's the way I've always seen it. I know I can do it with care and compassion. We can do it when it's the right time. It's an important welfare thing to do. It's an emotionally difficult time for their owners, clearly, and it's a real privilege to be able to help out when someone is losing a member of their family, essentially. It's not a nice privilege to have, but it's something that um, I'm glad that we can do. If yeah, it is tricky, and it's really hard to go from that sometimes to then the next consult might be a new bouncing puppy in. Um, I've got friends who are doctors, and the temptation is always to become hardened to it, I suppose, and divorce yourself from the feelings, because you do get this sort of vicarious trauma. When you come across someone who's upset, as a normal human being, you're going to get upset yourself, and you kind of you can only empathise. When I've lost dogs, it's awful. So yeah, you just gotta. I think you've got to rationalise it and think about it and not pretend it's not a problem. And yeah, you and remember the positives. Why you're doing it. If you can assure yourself that you're doing it for the right reasons, then I think you can go to bed happy or content, maybe. I have to say, I've never put down a healthy dog, thank goodness. Some of you might know I was involved in the foot and mouth disease crisis back in 2000, where we were uselessly putting down thousands of animals every day. I was very heavily involved in the Great Orton slaughter, and I found it very difficult to sleep for a couple of years after that. Jason never thought could put a scene. Yeah, it's the only compassionate. That's the word I was reaching out for. Yeah, thank you, Jason. It is. It's all about compassion. Yeah. Well, uh, I've had to do it to my own dogs, and that sort of thing, and so I can empathise with you guys. I'm not a sterile robot. Yeah, yeah. Well, thank you, Mel. It's it's always tricky thing to do, um, and not all passings are as what's the word? when you can, I mean, Linda's pre-euthanasia consults where you can actually get somebody in and you can counsel them and you can chat to them and you can kind of lead up to the putting an animal to sleep, and then you can be with people afterwards, and that just helps people get over the hump. But some passings are just completely traumatic, um, and I think I don't know how doctors do it because you know wow, I don't know. Can I use my vet superpowers to make dogs live longer? Short lives, and they're not even allowed to eat chocolate. Yeah, it sucks, doesn't it? They don't live long enough. They don't live long enough. Can I use my to make them live longer? But it's qualities, isn't it? Quality of life years. You know. Well, I have got to say, the animals living. Laptop's getting really warm. I'm just going to have to like that for a minute. It's and people actually. I don't think it's too far away in the future. I'm not some crazy longevist, but there's a technology coming through called CRISPR, continuously repeated interspersed. No, let me get this right. Contiguously, regularly interspersed short pattern repeats. I think it's called CRISPR technology, Cas9. Essentially, it's chopping out genes and actually in vivo, so in people and in animals, actually being able to live edit our genes. There's a thought that essentially these little caps on the end of our chromosomes called telomeres get shorter as you get older, and that predisposes the cells to more damage, and that's why we all start, that's what goes wrong. That's why the wheels start falling off a little bit. But we now have this technology which potentially we can live edit our genes as we go through. I mean, it will be used initially for things like cystic fibrosis, Huntington's, chorea, that sort of in correcting genetic problems. Um, but it could be potentially used to improve our longevity as well, which I think it's still got issues at the moment. It does do damage where it shouldn't do damage, but keep your eyes open for it. CRISPR, CRISPR. We need to crowdfund research. I think there is quite a lot of research going into CRISPR at the moment. It's probably a good time to invest because they found over the weekend, like I say, that one of the research companies have found that there's more damage done to the DNA than they were originally expecting. But it'll be fixed. It all comes from the bacterial immune system. So it's how basically the bacteria, when the virus comes along, it chops out a bit of the virus and stores it in its own DNA. So yeah, that's how it works. And it can mount an immune response next time it comes on. It's like a memory for the immune system in bacteria. But I would say the other companies haven't found any problems with the damage to other parts of the DNA. It's quite scary as well because obviously there are certain uh, uh, races that exhibit certain genetic characteristics. So creating a genetic weapon now is starting to become something to start becoming quite worried about. Okay, 10 to 9. Any more questions? Oh, Lynn and her weight loss. Sorry, I missed that, Mel. Lynn and her weight loss clinic. Yes, Lynn and her weight loss clinic. She's great. She really Lynn's amazing in that clinic. She really takes an awful lot of care, and she's really passionate about getting weight down. Because just like in people, it's just a simple thing. Well, a simple thing to get right. It's not a simple thing to get right. Clearly, looking at what's going on in the world. Um, but if you can get the weight down, honestly, it makes things so much better on so many different levels. Not just improving outcomes with arthritis, but it makes surgeries. You don't get diabetes. You live longer. Da 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 da. Thank you for your support, Jason. So yeah, I got called a fat Nazi once actually by somebody. I think it was because I've got lurchers, and so my estimation of weights always tends to be perhaps a little lower. I like to see dogs perhaps a little bit leaner than than perhaps the breed standard would suggest. So chocolate Labradors, for instance, you look at the average chocolate Labrador and they're not overweight as far as I can see. But it's very. Angela's saying out here, health standards, not breed standards. Yeah, I've got a video on how to assess weight in your dog. Let me see if I can find it here. Da, 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 Let's have a little look. How to condition score, I think it was called. How to score your dog's bodily condition. Yeah, let me just post this link in the comments because people get very tied up with targets and things that they see on posters and stuff like that. But essentially, it's all about, does the weight fit the dog, rather than does the dog fit the weight. He looks like a massive loaf of bread. Poor Shep. It's interesting, actually, when you look through the sort of individual animals that come through the door, people really struggle to keep the weight down on some of them. Some dogs, just like people, we're all the same. We're all the same. And in fact, I've just written an article for this week's newsletter on consciousness in animals, and it's very, very similar to us. Well, if there are no more questions, I'm going to give you 1 more minute for any last minute questions. But if there are no more questions, I'm going to go and have a cup of tea. Hope this was useful. Didn't bore you all too much. Yes, I see a resemblance, Jason. Brilliant. Well, it's been great fun, everybody. Thank you very much. Maybe we'll do this again sometime. If you want to do it, then just let me know, and I'll stick it up maybe another month or two. We'll have another go. It's been really good. All right then. See you later, everybody. Bye, and thanks for being such a great audience. Really good fun. Bye.